This is Miranda Peterman. It is October 26th at 10:30 in the morning, and I'm going to be doing insulin administration using the pen and the syringe. I have checked my doctor's orders, and I have my orders with me for the Novolog pen 5 units. So I have entered into my patient's room, verified that this is the correct patient I'm going to be giving this medication to, and I have obtained the most recent glucose. We just took it, so that's what we have to do before we give any insulin, is obtain their glucose. And I have another nurse in here to double check what I give, okay? So we're going to go ahead and start by taking our pen. We're going to grab a new needle, and if this pen was already in the room, we're going to check and make sure that the patient label is on it, make sure that it's the correct medication, and it is. We're going to put a new clean needle on the pen. I'm going to take the cap off. Be careful, the needle is exposed now. And I'm going to prime with 2 units. This has to be done every time. Okay, so it's primed. Now I'm going to go up to 5 units, which is my order. I'm going to have somebody else verify that this is 5 units that I'm giving to this patient.
That is 5 units?
Okay, and I'm going to go up to my patient. I'm going to ask him, be like, okay, where did you last have your insulin? If we're using the abdomen, we're going to stay an inch or 2 away from the belly button. So I'm going to go over here on the left side, clean the patient, let that air dry, warn the patient, okay, here comes a stick. We're going to hold it there for 10 seconds, okay? Okay. And then this needle goes directly to sharps. Be careful not to nick yourself or your patient with it. Okay. Then this is recapped and replaced either in the patient's room where it was found or back into thrown away if it's a one-time use, whatever the order is for that pen. Okay, now we're going to be doing insulin with the syringe, and the order is for 4 units of regular insulin and 8 units of NPH for a total of 12 units for this patient. So I've checked my MAR to my Pyxis. I have pulled what needs to be given to this patient, and I've made sure that I have the correct patient again. So I'm going to go ahead and start to draw up the medication. I'm going to roll my cloudy, being sure not to be too vigorous. Don't shake it. Okay, I'm going to clean both of my vials. And we're going to be giving a total of 12. So I'm going to draw up 12 units of air to inject into these vials. 12. Okay, and we're going to insert 8 units of air into the cloudy, leaving just 4 units to inject into the regular. Okay, and then we have our regular. Four units. Okay, and then I'm going to go ahead and draw up 4 units of regular. I'm going to verify that that's 4 units of regular.
It is.
Okay, and then I'm going to draw up 8 units of my cloudy for a total of 12 units. Okay, verify that that's 8 units of cloudy with 4 of regular.
Okay, you're good.
All right, we're not going to recap that. We're going to go directly to our patient. Double check that this is our patient one last time. Double check that the order's correct one last time. Okay, we're going to go ahead and tell the patient, quick stick, and inject. This does not have to be held for 10 seconds, so we're done there, okay? And this goes directly into sharps. I would document how the patient handled the procedure, and then we also need to have a follow-up glucose check afterwards. That is all.